بسم الله الرحمن الرحيم. السلام عليكم ورحمة الله وبركاته. معاكم مدرس الدكتور باسم البياتي، فرع الأحياء المجهرية، كلية الطب، جامعة بغداد. محاضرتنا اليوم الجزء الثاني من الميكولوجي. بالمحاضرة السابقة تكلمنا عن الكانديدا البيكانز. اليوم راح نتكلم عن الكريبتوكوكس نيوفورمانس. Introduction. Genus Cryptococcus involve or include more than 37 species. Only neoformans represent the most important pathogenic species to human. This yeast is encapsulated with a large polysaccharide capsule both in host and on some culture media. And according to the nature of this capsule, the genus Cryptococcus neoformans classified into 4 serotypes A, B, C, and D. The first case of cryptococcal meningitis was reported in 1905. Here we see the 2 serotypes, Cryptococcus neoformans var neoformans and Cryptococcus neoformans vargati. A neoformans var neoformans involve 2 serotypes A and D found in soil contaminated with Bayesian droppings. It represents the causative agent of most common cases of cryptococcosis, whereas for the Cryptococcus neoformans vargati involve 2 serotypes B and C found in bark and plant debris under eucalyptus trees or decaying wood not associated with Bayesians. The source of infection. Here in this case, in the case of Cryptococcus neoformans, is the inhalation of spores or yeast cells or reactivation of a latent infection. واضح من البيكتشر انه البيجنز موجودة على اليوكاليبتوس تري. الدروبينج مالتها راح يصير which involve spores or yeast cells which will be inhaled into lungs, then disseminated to the central nervous system. Virulence factors here are first, polysaccharide capsule, melanin production, mannitol production, different enzymes. We should know that the host immune status seems to be more important than the virulence of the yeast. Also, immunocompromised patients or those undergoing immunosuppressive therapy are at increased risk of infection. Clinical presentation. First and most important clinical presentation is pulmonary cryptococcosis, which is either asymptomatic majority of the cases or symptomatic self-limiting case. After initial infection spreading to other organs or to other organs may occur. For the second clinical presentation, which is disseminated, which represent the first sign of cryptococcosis, meningitis or brain abscess are the most common presentation. Untreated cases are often fatal. Third, ocular lesions. Fourth, skin lesions. 5, cellulitis, and finally other clinical presentations such as bones, heart, testes, kidneys, and liver. Here we see cryptococcal meningitis, conjunctival cryptococcosis, cutaneous and mucocutaneous cryptococcosis. For the lab diagnosis, as we mentioned before, lab diagnosis consists of specimen which is differ according to type and site of infection, direct microscopy slide, culture, biochemical, serology and or molecular, and then antibiotic sensitivity test. For the first step, specimen, which we mentioned before that it is differ according to type and site of infection, CSF, biopsy, blood, sputum, urine, and so on. For the slide, encapsulated, a clear halo, round to oval, single celled. Here we see Myers mucicarmine stain used by the pathologist to stain the capsule in tissue sections. Here for the second picture, using of India ink test to demonstrate the capsule. Capsule هي the most common diagnostic feature. الculture For the culture done at 25 degrees centigrade, 237 for 48 to 72 hours on bacterial or fungal culture media, which involve first bird seed agar or caffeic acid agar. The colonies appears brown to black due to melanin production. Also on urease test positive, it hydrolyzes urea into ammonia. Third, SDA without cyclohexamide appears white colonies, white creamy to yellowish brown. For the biochemical examination of the CSF, mild elevation in CSF protein, normal or slightly low glucose, few lymphocytes, elevated opening pressure, numerous organisms. Cryptococcus neoformans differ from Candida species by hydrolyzing urea into ammonia and not forming pseudohyphae. تذكرون احنا من تكلمنا بالمحاضرة السابقة بالكانديدا البيكانز شفنا بيها جيرم تيوب او شفنا بيها كلاميدوسبور. هنا نشوف بيها الكبسول. يعني اذا اريد نسوي في الدايجنوستيك فيتشر او يجي سؤال what is the diagnostic feature of Candida albicans under in the slide or under the microscope هي formation of germ tube or chlamydospore, whereas what is the diagnostic feature of Cryptococcus neoformans is the formation of capsule. Serology not useful in humans as antibodies are often found in healthy individuals. Latex agglutination test, indirect fluorescent antibody test, a tube agglutination test, and ELISA. This is the kit for Cryptococcus test. For the therapy or for the treatment, therapy here consists of long-term, lifelong therapy may be required in AIDS patient after initial therapy as infection responds slowly to treatment. Treatment consists of 3 phases: induction, consolidation, and maintenance. Thank you for your time.